What if the scariest enemy of a woman's intimate health is not outside the body, but already waiting inside? Imagine ending a beautiful night with love and laughter, only to wake up at 3 a.m. with a burning pain so sharp that tears roll down before you even reach the bathroom. Every drop of urine feels like fire, your heart races, your hands shake, and in your mind, one terrifying question repeats: what happened to me? More than half of sexually active women will face this horror at least once in their life, but most of them will never know the real reason behind it until the pain has already taken control. I am Dr. Ayurmoolam, and tonight we are unlocking a secret that many women discover only after suffering in silence. Urinary tract infection, UTI, may sound like just another medical term, but when it targets a woman right after intimacy, it turns comfort into panic and love into fear. This topic matters because women often blame themselves, partners get confused, and relationships face stress. Understanding sexual health is not about shame. It is about safety. It is about preventing the pain that arrives without a warning, like a suspense villain who strikes in the dark when nobody is watching. It begins with subtle warnings. A woman finishes urinating but still feels like she needs to go again. A burning sensation crawls upward, turning into severe discomfort. Sneezing or pressing the abdomen feels painful. Some women feel a dull ache near the lower belly. Some get fever and chills as if the body has entered a war. Doctors notice redness, swelling, tenderness, and signs that bacteria are already inside the bladder, multiplying rapidly. Many women feel embarrassed to talk about it, so they ignore the warning signs until the infection becomes a frightening emergency. The truth lies in the body's structure, and it is shockingly simple. The female urinary tube is very short, located close to the anus and the vaginal area. During sexual activity, when movement happens quickly and repeatedly, bacteria take advantage of the situation. E. coli, a tiny but dangerous enemy, travels upward into the bladder and begins its attack. Stress weakens immunity. Not drinking enough water helps bacteria stay inside. Holding urine traps them even longer. Harsh soaps destroy the natural protection of the intimate area. Ayurveda explains that too much heat in the body, pitta imbalance, leads to more burning and inflammation, while vata imbalance causes cramping, urgency, and spasms. So the root cause is always a combination of behavior, hygiene, biology, and unawareness. The dangerous twist appears when a woman waits, thinking it will disappear on its own. If symptoms continue more than 48 hours, or if there is blood in urine, fever, vomiting, or severe abdominal pain, a bacteria may already be moving from the bladder to the kidneys. That is where the real horror begins, because kidney infection is much more painful, more risky, and can become life-threatening. Diagnosis is very easy. A routine urine test or urine culture can identify the infection clearly. Sometimes ultrasound is needed for repeated cases. Early detection turns the entire story in your favor. Treatment becomes a complete strategy, not just one pill. Diet must support healing. Hydration is the strongest weapon. Water, coconut water, fresh fruits, and warm liquids help flush out the infection faster. Spicy, oily, junk, and heavy foods make burning worse and delay recovery. Exercise improves blood flow, but only gentle activities during infection. Enough rest gives the immune system strength to fight. Medicines become essential in moderate or severe infections. Doctor-prescribed antibiotics and urinary soothing solutions give relief. Probiotics help rebuild protective bacteria in the urinary tract. Ayurveda provides powerful calming herbs like gokshura, punarnava, chandana, and guduchi that cool the system and restore balance, but always under guidance, never self-treatment. The most ignored but most powerful treatment is lifestyle. Never hold urine. Always urinate after sexual contact to wash away bacteria trying to climb upward. Avoid tight synthetic underwear. Keep the private area clean, but avoid harsh chemicals and scented washes that secretly destroy natural defenses. Lower screen time and stress because the mind is connected to immunity more than people realize. Sleep heals. Lack of sleep invites infection. Prevention is like giving your bladder a personal bodyguard. Begin your day with warm water. Stay hydrated throughout. Maintain gentle hygiene before and after intimacy. Trust your bladder's signal. Never wait. Keep the lower body dry and clean. Strengthen your immune system with healthy food and balanced routine. Support your emotional health because fear, shame, and silence are the actual villains that keep this infection returning. When a woman understands her body, she becomes her own protector. Now that you know the truth that many women never hear in time, do not let this knowledge stay with you alone. Share this video so that another woman does not sit in her bathroom crying in pain and confusion. Like this video if you believe awareness can prevent fear. Comment if you learned something new today. And subscribe to the channel Dr. Ayurmoolam, because we will continue exposing these hidden threats that attack women's health silently. Tonight you discovered the villain behind the pain and the power to defeat it forever.